we should really use essentially a heart attack model. Right? So if someone suffers a heart attack, first of all, we don't question whether we should resuscitate them or not, even if it's their second or third heart attack. We don't judge them, and we shouldn't judge people who might overdose from an opioid. We resuscitate them, and then we bring them to the emergency department for further care. But at the end of their care, when they're initially medically stabilized, we don't go into the room of the patient with a heart attack and say, you know, Mr. Jones, you had a heart attack and you almost died. So we're going to discharge you now, and we're going to give you a card of a number of different cardiologists in the area. You should probably call them this week. But that's sometimes what happens to patients who overdose. So we can't let that happen. We need a firm, warm handoff. We need to engage that patient and their family right in the emergency department and get them right into the treatment that they need to recover from their addiction and their disease.
Warm handoffs, simply put, are based upon a relationship, are using that relationship to leverage help for others, and involves 3 or more people working together. What is often missed in the discussion of addiction is the critical role that relationships play. The success of a person's treatment and recovery are directly related to the strengths of their relationships.
Addiction is a disease, and this disease is not any typical disease. It's a disease that causes dysfunction that has biological, psychological, social, and spiritual manifestations. And in one way or another, it has affected all of us. Addiction needs to be managed as a disease, and it's imperative for all of us to elevate our standard of care in order to take care of this patient population. Collaboration, connection, and communication is the only way that we'll be able to attack this epidemic.